COVID-19 has laid bare the inequities that we have long known are rooted in historical racism, injustice, and discrimination. Addressing these societal problems is going to require strong leadership, and I'm very thankful to all of you for providing that. The COVID-19 pandemic is the most significant public health challenge of our lifetimes. To bring this epidemic to an end, we must vaccinate as many people as possible. On one hand, the math is simple. We have to get to at least 80% of the population vaccinated. But doing so equitably and ensuring that no one is left behind will require effort and resources. We have begun by identifying 32 priority communities. These are the 32 most vulnerable communities in our suburban Cook County jurisdiction. We did this based on a number of factors, including barriers to medical care, socioeconomic factors, and the prevalence of chronic conditions which put people at risk for COVID-19. Ensuring that the residents of our most vulnerable communities, particularly our Black and Brown communities, are vaccinated is the right thing to do. But it's also good public health because it ensures that everyone in suburban Cook County is protected. Looking at the bar chart to my left, you can see one way that we're going to be measuring progress. This data and more will shortly be made available via our website, cookcountypublichealth.org. What you see here are two sets of numbers. You see a pair of bars there. The blue is the percentage of the vaccinated population, and the orange is the percentage of the overall population of that group in suburban Cook County. So for example, the Latinx population comprises 19% of suburban Cook County's population, but only 10% of the vaccinated population. This is a clear issue, and we are prepared to respond. The simplest way to illustrate success here would be to have each pair of these bars be even, showing that each of these subpopulations, each of these groups, were being vaccinated according to the proportion of their overall population. This is hard work. Equity is hard work. And reaching these levels will test us. But we know we have the systems, the people, the processes, and certainly the desire and the leadership to get it done. We've identified and operationalized a number of strategies that will help us get to equitable vaccine distribution. Community-assisted scheduling, through which we reserve appointments at mass vaccine sites for community groups who are trusted messengers to schedule vaccinations for their clients and for patients. Vaccines on the Go are mobile programs through which we have provided over 20,000 doses of vaccine at over 140 pop-up clinics throughout the suburbs. Priority pods, or points of distribution, designed specifically for those who live in the 32 priority communities. These last a bit longer than the mobile or pop-ups that I just mentioned. During the course of our vaccination program, we've launched a number of vaccine sites across the suburbs. I've always been struck at these events when I paid a visit to them, how the socially distanced crowds were a cross-section of suburban Cook County residents. This beautiful diversity illustrates that we're all in this together and that we must work together to bring this pandemic to an end.